How do you deal with the need to say no in a role play or a consultation? I'm Dr. Arora from Arora Medical Education. This video is all about if you get a case where you need to say no, firstly, should you do it? Secondly, how do you do it? Okay, so the first thing is, of course, there are situations where you need to be able to say no as a clinician. You might get a scenario where someone is demanding, I don't know, some kind of investigation, some kind of treatment that you know as a clinician is not needed. So we're just in Goa right now. So if there's a background noise, you can see it's a beautiful day in Goa right now. Give a quick pan of this place. So sorry if you get some background noise of the pool. But yeah, there are going to be some cases where the test is of your ability to say no. So if you get pressurized by an angry patient, a demanding patient, a frustrated patient, and you end up giving something that you shouldn't do, then that's probably going to go against the test. So should you do it? Yes, there are certain scenarios where you should. There are lots of rumors that go around saying, you should always make sure the patient doesn't leave angry or always make sure the patient leaves satisfied. That's not true, okay? You are going to sometimes need to show your ability to say no. However, there are a couple of things that you should do or think about doing that make the saying no process a little bit better from an assessor's viewpoint. So the first thing is, so I do a lot of practice with people doing PLAB 2, RCA, CSA, that type of thing. And the first thing I see is that people are very waffly or very fudgy about saying no. So there's not a clear no. So you know that you want to say no, but it doesn't come out clearly. There's a lot of kind of pros and cons and a debate happens, but there's never a point where you say, actually, you know what, I don't think this is the right thing right now, or I don't think it is the most appropriate thing right now. So the first thing I would say is, if your gut feeling is telling you, if you've done your assessment, if you've done all your workup, and of course you have to do your workup first, you have to go through red flags like social ice, understand why they want it, etc. But once you've made the call in your mind that it's not going to happen, or it shouldn't be something that I should agree to, then you've got to be clear. Mr. X, I can see that, obviously on your mind, the thing that you want most is a CT scan. Look, I'll be honest with you, having assessed the situation and asked you a lot of questions, examined you, this is not something that I think is the right thing at this particular stage. Okay, so be clear and confident about the fact that you don't think that this person needs what they're asking for. Don't beat around the bush, don't be woolly, don't try and just be too friendly and kind of get into that trap of I don't want to annoy this person. However, the most important thing about saying no is that you should not leave it hanging on a note, because if you leave it on, Mrs. X, I really don't think that actually antibiotics are needed at this point, the guidelines don't say that, etc., and then you pause, that's when you invite a potential barrage, or why not, and I think it's appropriate, and can you get a second opinion, etc., and that might push you into turning a no into a yes. The key is when you give a no, you've got to flip the story forward. You've got to move it on to something else that potentially could still help this person out, or something that may interest that person. So for example, if someone, I don't know, is demanding antibiotics and you think it's a sore throat, they don't need antibiotics, don't just say, I don't think you need antibiotics. Say, look, Mrs. X, I don't think at this point, having examined you, that antibiotics are going to help you with your sore throat. However, there are 2 or 3 things that I can suggest that I think may really help with your symptoms. Boom, 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 boom. And then you're off into a different conversation. So you've taken the conversation away from the fact that you're saying no into a conversation about how am I going to help you with something else. Okay, someone comes in with a CT scan, a request for a CT scan. I've had this cough for ages and I want a CT scan, I demand a CT scan. Rather than saying, look, I don't think you need a CT scan, full stop, flip the conversation to something else. Mr. X, look, I think, right now, having talked to you, examined you, I don't think a CT scan is probably what's necessary. However, there are a couple of things in my mind that I think that may really help, both with your symptoms, but also investigating the problem underneath, maybe X, Y, Z. And then you flip the conversation into something going forward. Because the key thing about saying no is it's not easy to say no. No one likes saying no. No one likes being told that they can't get what they want. But the key is make sure that you flip the conversation forward. That's your job. Okay, your job is to flip it into another field of what I am going to do to help, rather than getting stuck in the bit which is, I don't think I can give you what you want. Okay, so when it comes to saying no in things like PLAB 2 or RCA or medical school exams or whatever it might be, number 1, it's okay to do it when you need to do it because you may be being assessed on your ability to do so. Number 2, be clear and confident when you say no. Don't be woolly about it. But most importantly, number 3, don't leave it at the no. Flip it forward. Take the initiative to jump into something else that could potentially help that person with whichever problem they may be presenting with in the consultation or the role play. I really hope this helps. Don't be afraid of saying no. Just practice your ability to flip it forward. I have so many more videos like this on consultation skills, communication skills for things like PLAB 2 and RCA and medical school exams and CSA and other kind of OSCE type exams on the YouTube channel. So please do subscribe, share, like, comment down below if you found this video of some value. If you want to get 10% off any of our teaching courses, whether it's online courses, live courses, mock exams, face-to-face courses, flashcards, etc., then please use the coupon Arora Video 10, ARORAVIDEO10 to get 10% off anything on the website, aurora.medicaleducation.co.uk. I really hope this video has been of some value. Please do watch for other common skill videos. Have a beautiful day. We're, like I said, in beautiful Goa right now. It is hot, it is humid. It is a super place to visit if you haven't already. Have a great day. Hashtag camp as well pass. Hashtag I went with Arora. See you on the next video.